week 2 of our postpartum low back pain series. Last week we talked about stretches that would help you relieve the low back pain and to get started in week 1. This week we're diving into core strengthening exercises that would help you build stability in that pelvis and hip area and help you kickstart your strengthening journey as we manage postpartum low back pain. But before we dive into today's video, hi, my name is Shredi and I'm a board certified physical therapist specializing in postpartum health. My goal is to help postpartum moms just like you regain strength and confidence and start feeling healthy in less than 15 minutes a day. As a busy mom, I understand you don't have a lot of time for yourself, and on this channel, I want to make sure I can share tangible tips and resources that doesn't take long but would help you prioritize your health as well. Let's get started with today's session. Today we will be doing a combination of floor exercising and standing exercises focused on core strength and hip strength. When it comes to managing low back pain, it is very crucial to work on overall body strength as your spine connects to the lower body, and dysfunction in one segment of your body would definitely affect other joints. So as we start our strength journey with low back pain management, we want to focus on regaining the core strength but also focus on developing hip strength and pelvic mobility. So for our first exercise, I want you to go ahead and grab a small ball if you have. If not, you can grab a pillow or something soft which you can squeeze. We'll start on the floor. Make sure you have a pillow or a yoga block to support your head. Make sure to roll onto your side and then gently roll on your back. We'll go ahead and put the pillow or the ball between your knees. For the first exercise, we will have the hands on the side, and then whenever you're ready, we'll go ahead and squeeze the ball and lift the hips up in the air. We will hold this position for 3 seconds and then gently lower yourself down. With these exercises, we're targeting the inner thigh muscles, but we're also building up the core and the glute strength as we bridge up and then slowly come down. So whenever you're ready, go ahead and get in position. Place the hands on your side. Take a deep breath in. And then as you exhale, squeeze the ball and lift your hips up in the air. Hold for 3 seconds. And then gently come down. Now we will go ahead and do this 10 times. Do this at your own pace and just look at me for reference if you need to look at the posture, alignment, anything. So whenever you're ready, take a deep breath in, and then as you exhale, squeeze the ball and lift the hips up. Hold for 3 seconds and then gently come down. Every time before you start the exercise, I want you to take a deep breath in, and then as you exhale, that's when you go ahead and start the exercise. This helps you build up endurance and you're able to function for a longer time without feeling short of breath. So it is very important to focus on breathing and pairing your breathing with the exercise you're doing. Even with your daily activities like picking the baby up from the floor, loading the dishwasher, try to take a deep breath in and then perform the activity. That way you are bracing your core and you're not injuring yourself in doing any activities. We're halfway there. Let's try and do 5 more. And the goal here with the bridges is not to go really high, but it's to clear the hips off of ground. So if you're in the early weeks of postpartum, maybe 6 to 8 weeks or even up to 2 months, you might not have a lot of strength and you might feel wobbly going up. So don't try to really push yourself and go up too high. Just try and clear the hips off of the floor and then hold for 3 seconds and then gently come down. Good. Let's go ahead and do one more if you're doing it with me. And if you're doing it your own pace and if you're doing it slowly, that's totally fine. And relax. Perfect. We'll go ahead and take the ball out and we're going to go ahead and put that on the side. For your next exercise, we'll go ahead and roll onto your side. We'll make sure your knees are stacked on top of each other, pelvis rolled forward. Make sure your feet are on top of each other. All we want to work on is lifting the top knee up. Hold for 3 seconds and then bring it down. When you lift the knee up, I want you to make sure that your pelvis stays rolled forward. So often I would notice that when you lift the knee up, moms would try and tilt it back so you have more range. But the goal here is not to get more range, it's to activate the muscle on the side of your hip. So making sure your pelvis stays rolled forward is really important in this exercise. If it helps, put one of your hands on the pelvis to kind of guide the movement. So now holding the pelvis forward, feet together, let's lift the top knee up. Hold for 3 seconds and then gently come down. Let's go ahead and take a deep breath in. And then as you exhale, lift the top knee up, holding for 3 seconds. And down. I really want you to feel a tension on the side of the hip you're working. Again, you will notice that I don't have a lot of range here because I'm really focused on activating the muscle, and that's exactly what I want you to do. Try not to roll the pelvis backwards, getting tempted to gain more range, because the goal here is not to have more range. The goal here is to activate the right muscle. Deep breath in, and then as you exhale, lift the top knee up. Hold it for 3 seconds and then gently come down. And we're going to go ahead and do this 10 times on each side. And if this starts feeling easier as you do this every day, go ahead and add some resistance bands. Start with the lighter ones and then you can progress to the heavier ones eventually. Good. Give me 3 more. At any point, if you feel you're getting short of breath, feel free to pause the video, take rest. Make sure you're staying well hydrated. So have a water bottle with you. So if you start feeling dizzy or if you start feeling weaker, go ahead and pause the video, drink some water, and then start again. Let's do 1 more. And relax. Now you can go ahead and roll onto your other side. I'm going to go ahead and sit up and switch sides. Make sure your head is well supported on the pillow or the yoga block. I don't want your head to be laying on the floor like this, because when it lays directly, your head is kind of tilted and that messes up your spinal alignment. So it's really important to have your head lifted up so the spine is in a straight line. Now whenever you're ready, make sure your knees and the feet are stacked on top of each other, pelvis rolled forward. Use one of the hands to keep it steady. Make sure your feet are together. We'll take a deep breath in. And then as you exhale, we'll lift the top knee up. Hold for 3 seconds. And then we'll gently come down. We're going to go ahead and do this 10 times. The goal is to feel a muscle working on the side of your top hip. If you don't feel the muscle burn, it's likely that your pelvis is rolled backwards too much. So try to fix the pelvis first by rolling it forward, and that should make a difference. Make sure you're taking a deep breath in before starting the exercise, and then as you breathe out, you initiate the movement. Good. And you can do this at your own pace. If this is too fast, You can pause the video, do this 10 times, and then resume watching the video again. Make sure you're taking deep breaths in through the nose and out through the mouth as you do the exercises. At no point I want you to be feeling short of breath or feel like you just cannot keep up or do this anymore. These are real easy strengthening exercises, and I really want you to focus on your breathing so you can push through and finish the 10-minute workout together. Make sure you have a water bottle with you, so if you start feeling weak, tired, short of breath, you can sip on some water and that would help you get back on track. Good. Let's do a few more. You really want to start feeling a muscle burn right here once you get to the 8th rep. And then once this starts getting easier, once you feel like your posture is correct but you still don't feel the muscle burn, that's when you can go ahead and add the resistance bands. You can start with the lighter ones. Try it for a couple of days, make sure your posture is good, and then once it gets easier with the lighter ones, progress to the medium and then the heavier ones. Let's do one more. And relax. And then gently go ahead and sit up. Good job, mamas. You're doing really good. I'm proud of you for sticking around. Let's take a pause here and go ahead and drink some water and then come back hydrated. I hope that was a good break. For our next exercise, we'll go ahead and lay on the side and roll onto your back again. Make sure you still have the pillow or the yoga block to support your head. For this exercise, we'll leave one knee bent but straighten out the other leg. Make sure your back is flat on the ground or on the yoga mat. So at no point I want to see an arch down there. So consciously make sure you're tilting the pelvis backwards to flatten your back. And then whenever you're ready with the straight leg, you'll point the toes towards you and we'll go ahead and lift the leg up. The bent knee is going to act as a reference, so at no point we want to lift this leg up super high. It has to stay in line with this knee or a little lower. You just pause for a second and then you bring it down. And now if this feels too challenging where you have to lift from the ground and bring it up, start in a position of both the knees bent, and all you want to work on is flattening the back and then kicking up and then bending it down again. So see whatever feels easier for you. I don't want you to strain or push yourself too hard. We're just getting started with the strength training and you want to make sure it is challenging but it still is easy. Don't feel that you have to strain yourself to make it through. I'm going to go ahead and do it with the straight leg, but if that is too strenuous, bend both the knees and work on just straightening the leg and bending it back. So make sure you're taking a deep breath in, and then as you exhale, we'll work on lifting the leg up, pause, and then gently bringing it down. Make sure your back is flattened at all times. I don't want you to be arching the low back or even using your upper body muscles. Sometimes you would tighten that upper body all the way like this to help you pull the leg, and that's not the goal here. The goal here is to really use the core muscles and the leg muscles to help you lift the leg up. So if you feel you have to engage more than those muscles, it means that the lifting the straight leg up is just a little harder at this time, and that's totally normal. It takes time to regain the strength, so be patient and just do the modified version until you feel stronger. And I'm sure you will feel stronger soon and you will be able to do this. But if at this time this is harder, choose the modified version. And if you are doing the straight leg, I want you to make sure that your toes are always pointed towards you. I don't want the toes or the foot hanging down. Make sure you have a good control on your foot and it is lifted up. Let's go ahead and do 3 more if you're following with me. If you are slower, that's totally fine. Make sure you do all your exercises slow and controlled. I don't want you to be rushing through these movements, just doing it fast and trying to get done with it. The goal here is to engage each and every muscle, small or big, so you can strengthen the body properly. And relax. We'll go ahead and switch legs now. So bend the knee that was straight and then straighten out the bent leg. Make sure you point those toes towards you. Flatten the back, and then whenever you're ready, take a deep breath in. And then as you exhale, we'll lift the leg up, pause, and bring it back down. Slow and controlled, no jerks, and you're not trying to use the muscles from upper body. We're focusing on using just the core muscles and the leg muscles. And make sure you're breathing good, in through the nose, out through the mouth. It is really important to coordinate your breathing as you exercise, because otherwise you will start feeling tired sooner and you won't be able to engage the muscles correctly. If at any point you feel you're getting tired, it is okay to take a break, sip on some water, and get back with your exercises. This is not one approach fits all, so modify as you need, listen to your body, and do it slow and controlled. Give me 2 more if you're going along with me. And we'll do 1 more. And relax. Go ahead and bend both the knees. And then gently roll onto your side and we'll sit up. Good job, mamas. I hope you feel the burn in your legs. We have 1 more exercise to go. But if you need to take a break, sip on some water, feel free to pause the video and then come back whenever you are ready. Perfect. And for our last exercise, we're going to go ahead and use a big exercise ball. I want you to stand at the wall, place the ball between yourself and the wall. The ball should be right at that low back arch area. You'll go ahead and gently get your feet forward, put all your weight on the ball, and then whenever you're ready, we'll gently squat down, sliding down, and then come up. It should be a gentle sliding movement. Make sure all the weight is on the ball. So at no point I want you to be leaning forward or your hips to be hanging out. It should be nice and steady, leaning on the ball, the feet pointing straight. Take a deep breath in, and then as you exhale, we'll squat down and up. Remember, we're not trying to squat all the way down. It's not a deep squat. We're just getting in the movement, activating the muscle, and then coming back up. As you squat down, make sure your knees are still staying straight. I don't want them to be coming in, collapsing like this. We want to make sure they're nice and straight, and then you're pausing for just a second or 2, and then coming back up. And then make sure you are coordinating this with your breathing. So deep breath in, and then as you exhale, you'll squat down, pause, and come up. Awesome. Make sure your weight is all on the ball. I don't want you to be leaning forward. Put all the weight on the ball. Let's do 2 more. And if you're going slower than this, that's totally fine. Do it at a pace that's comfortable to you. And you can always pause the video if you need to take a rest break. And relax. I really hope you found this video helpful. These are our basic strengthening exercises that will help strengthen your core and hip muscles. As we move from week 1 to week 2, the focus is developing strength in the core and the lower extremities. And as we progress to week 3 and week 4, we will keep building up strength and eventually move on to more mid-back and upper back as well. I hope this video was helpful. If you found this helpful, make sure to hit the subscribe button below. It really helps me to know that you are liking and enjoying these videos. And if you missed the first part of this postpartum low back pain series, make sure to check out the videos, and there is a playlist titled Postpartum Low Back Pain. So you will find the stretches from week 1 in that playlist. Take care, mamas, and I'll see you again next week.